And the subject we're going to talk about today is hypertension. Now, in the UK, there are approximately 10 million people suffering from hypertension. That's approximately 1 in every 5 people. So that begs the question, what is hypertension or high blood pressure? Well, with regards to hypertension and high blood pressure, there are 2 main factors involved. Now, that is the velocity at which the heart pumps the blood around the body, and also the rigidity or stiffness of the arteries. So the blood pressure is basically the pressure against the artery wall. Now, what are some of the things that could cause the pressure of the blood to rise? Well, one of the factors is, as I've just said, if the artery becomes more rigid or stiff because of internal aging of the arteries. Another factor is cholesterol. The body could start to produce too much cholesterol itself, and also the person could start to because of their diet, intake too much cholesterol within their diet. And again, this cholesterol could go around the body and form itself around the arteries. So what happens is the hole within the artery, the tube, gets tighter, so the blood struggles to get through that hole. Another factor is that the blood could start to coagulate. The blood becomes thicker, the cells start to crush on top of one another, and again it will struggle to get through the arteries. With certain capillaries, certain red blood cells have to go through one at a time. So those are some of the factors that could cause the blood pressure to rise. Now, blood pressure is measured in something called like the systolic or the diastolic. Now, the systolic is when the heart pumps the blood and the blood's being pushed away from the heart. That's the systolic. And the normal reading for that should be 120. And that's the first number. And then you've got the diastolic, which is the number when the heart starts to fill up with blood again, or in other words, the veins start to transport the blood back to the heart and the heart starts to fill up. That one's called the diastolic, and that should be, the normal level should be 80. Now, certain sources say that as you age, your arteries should naturally become more rigid. But really, we would want to try and keep our blood pressure at 120 over 80. And even though we're beginning to age, we should still try and keep it at that level by living our lives in the right way. So those are the 2 things. You've got the systolic and you've got the diastolic. Now, what are some of the things or symptoms that could cause a person's, if a person were to get high blood pressure, how would they know? Well, in some ways, they call hypertension or high blood pressure the silent killer, because there aren't usually that many symptoms. But some of the symptoms that a person might get at times might be they get insomnia, they might get headaches, very rarely nosebleeds. So, but in general, there aren't that many signs to show that someone's getting hypertension. But the dangers are that it could lead to things like coronary heart disease, stroke, and a number of other things. So it would be wise for someone to get a blood pressure machine and regularly measure your blood pressure, maybe every 3 months, every 2 months, or something like that. So if you'd like more information or to know natural ways of helping your health and improving your health, contact me. As I've said, my name is Dr. Stephen Ferguson from the Natural Health Clinic for Health and Well-being.